Hi, hey everyone, I'm Chris Lethem, and today we are doing a show called The State of Health. I'm filling in for Jay Fidel, and we're going to talk a little bit about hepatitis C. Today's guest is from the Department of Health, Thaddeus Pham. Thaddeus, welcome to The State of Health.
Thank you for having me.
Yeah,
Chris.
great to have you on the show. So we're going to talk a little bit about the exciting stuff that you're doing.
Right.
Hepatitis C is now an issue where we now have treatments, very effective treatments available.
Yeah.
And this is a very exciting time.
Yeah. Very exciting.
There are some challenges, but it's a pretty exciting time.
Yeah. Overall, we're excited.
Yeah.
Yeah. It's kind of a game changer, I think, not only for hepatitis, but for public health in general.
Yes.
Yeah.
Yes.
So, yeah.
We worked a few years ago. I worked on the Hepatitis B project, which was a project where they're going around inoculating fifth graders.
Great.
Because we have a vaccine for hepatitis B.
Mm-hmm.
Now, do we have such a vaccine for hepatitis A, by the way? I'm just curious. Now, I'm just going to bring this. I know it's a sort of ancillary topic.
No, that's fine. Yeah, there's a vaccine for Hep A and for Hep B, as you know, but for Hep C, there's no vaccine.
There's
right now.
no vaccine for Hep C.
Yeah.
And this has been it's challenging because, you know, in the world of diseases or viruses, this is an RNA-driven virus.
Right.
Which means it does random stuff. That's what RNA stands for, random. You know,
yeah, that's a scientific word for
random.
it, right.
You know, it just goes and does whatever it wants to do.
Yeah.
You know, so that makes it very hard to treat.
Right. So Hep C was hard to treat.
Was hard to treat.
And now there's lots of great drugs out there to
we always know how important it is.
Yeah, I knew you would like that, Chris. So lots of great drug therapies to really help people who are living with hepatitis C, so they don't go on and develop liver cancer. So in a way, what we're doing with Hep C is preventing cancer.
So so we can't necessarily vaccinate for it, but we do have now today a very effective treatment.
Right. Yeah.
So how did you get involved in this? Because this is just like out of nowhere.
That's a good question. So I was originally working in the Department of Health with HIV, and I got really involved with the community, really working with people who were typically underserved, who don't really get all the resources that other people might get. So when this position opened up for hepatitis, I was asked to step in because they knew that I worked with the community very well, and that I really believed in the social justice aspect of getting people help.
Okay,
yeah.
That's great. That's great. Now, obviously, you've developed a little bit of a background knowledge about this disease. Just a little bit, right?
Yeah.
Now, when you sort of said, you also sort of are now applying the relationships that you developed working on the HIV problem.
Right.
And where are we, by the way, on the HIV problem? Have we made good headway on that?
We're one of the states with the lowest HIV rate, so that's good. But there's any new case of HIV is something that we should be concerned about.
Yes.
So there's still new cases happening. There's still a lot of people that need help. So we still have some work to do for HIV as well.
It's and it's also sort of in the same family of problem viruses, in that it's also very much an RNA strand, or it's RNA.
Right. Yeah. HIV is also a virus. It kind of does a lot of damage in that way, and like Hep B, but not Hep C, it's incurable, right? So once you get it, you got it.
Once you get it, you've got it.
Yeah.
Okay, so so that is something that we continue to monitor and watch out. Now we've got some fairly good medications for that to help to mitigate the long-term damages of HIV.
Yeah.
But hepatitis C is something that up until now we haven't really heard a lot about.
Yeah, it's unfortunate too, because there's even data showing that in 2007, more people started dying from Hep C than from HIV.
Oh, is that right?
Yeah. In 2007, across the U.S., more people started dying from Hep C. So coming from HIV, I think we did a really good job, and we're still doing a good job. We're still pushing forward, but in a way, we neglected Hep C, and to the detriment of the people who are now impacted by it.
Well, in my own personal life, I have a sister that was exposed and had to get treated for hepatitis C.
Yeah.
And so I have some direct familiarity with the problem with hepatitis C. She and her husband both acquired it, and they had to go through treatments for like a year with this drug called interferon or PEG interferon or something like that, right?
Yeah, the old school drug.
That is a vicious treatment.
Yeah, it was super gnarly. I mean, I go to Hep C support groups every month just to kind of see what's happening. And people who are on that treatment, you know, it was really daunting for a lot of people, to the point where they would just rather not get cured.
I mean, they were just like ready to give it up than continue with the treatment.
Yeah, and it really, you know, for people who had depression or anything like that, it really exacerbated a lot of mental health issues as well. So
yeah,
it was
and I can
a hard
imagine.
treatment.
And I know with my sister, she had challenges with keeping her white blood count up.
Right, yeah.
Or trying to keep it stable,
Yeah.
I guess is the right term, maybe, to keep it stable. Because it was going up and down, because she was getting shots at the wrong time. And they didn't have it sort of set up properly, because they were measuring her at the wrong time and then trying to compensate, and that was causing problems. So it's just very complicated and complex treatment process. And I guess it had fairly good results.
You know, you know, the sucky part is that it was really harrowing. It was really hard to get through, and the results were not super great. They're around like 60% sometimes. So you still had a huge chance of not being cured.
So the cure rate was less than maybe 60. You said 60%.
60. I mean, sometimes, and nowadays the cures are up to like 90% plus.
90 plus,
and they're shorter. There's less side effects. So there's really
and interferon was given by injection. Is that right?
Right. Yeah, you could inject yourself or have someone inject you with interferon.
Wow, not fun.
Not fun at all.
Not fun. So now. Now let's talk a little bit about what the symptoms are for hepatitis C. Because if we've got listeners or viewers out there that are watching this show, and they think, well, you know, how would I know if I had Hep C?
That's a really good question. So,
what symptoms should you be looking for?
Well, the main thing to remember with Hep C is it can take 20 or 30 years before any symptoms show up. So you might not have symptoms, but it could be in there doing its damage already. And by the time you get symptoms, which could be jaundice, like yellow skin or yellow eyes, or you might feel, you know, really fatigued all the time, or
just a general malaise.
General malaise, yeah. So it's kind of really hard to tell unless you turn yellow.
But I feel like that. Yeah, I feel like that on Monday mornings. I don't know.
Well, Chris, maybe you should get tested for Hep C. But no, yeah, it's like you said, right? It's very vague unless you turn yellow or something. So it's really hard to tell. So for people who are at risk for Hep C, they should really get tested to know for sure.
So how would I know if I'm at risk?
That's a good question too. So if you're at risk, Hep C is spread from blood to blood. So if you've been exposed to blood, like if you've been, had a needle prick from someone where the needle was, or if you shared needles.
If you share needles at any point in the past.
At any point in time. If you're a baby boomer, that's one that kind of surprises people.
Well, baby boomer, give me the what's a baby boomer? Define baby boomer.
So the definition that we're using for baby boomer is anyone born 1945 to 1965. So anyone in the age group is at higher risk for Hep C.
And why is that?
They think there's a lot of reasons. It could be a lot of things that are happening in the 60s in terms of like blood screening. There's not a lot of blood screening happening back then.
People who might have been getting blood? During surgeries?
Right, surgeries, or even, back then we didn't do a lot of blood protocol things. So I remember stories of vets who said they would just stand in line before going to Vietnam and getting vaccinated, and they would get the same vaccine gun all down the line.
I got that.
You know what I mean?
I was in the Marines.
Okay, yeah. So
and as a Marine, we stood in line, and the guy had a gun.
Right, yeah.
And you got hit.
Yeah.
I mean, you just came up and bam, next guy, bam, next guy, bam.
Yeah, and they tell stories about, and if you flinch, and sometimes it'll miss
tear your skin.
Yeah, and there'll be blood, and then I would just move on to the next guy.
That's right.
Yeah, so vets are also really at risk for Hep C.
Thank you, Uncle Sam. Really appreciate it. Thank you.
Appreciate your service.
Yes.
So yeah, we're always trying to take care of all these our baby boomers, our vets in Hawaii. We have a lot of vets, so really just reminding people that you are valuable and that you are part of the community. So get tested so we can help you.
Okay, how do I get tested?
Really simple.
Okay, is this going to be a long, drawn-out process, or do I have to go to the VA and stand in a long line?
Well, for you, Chris, yes.
Oh, okay.
No, it's a really simple blood test.
Okay.
And I work with the VA too, so they're really trying to make sure that they get all their vets tested and treated. But it's a blood draw. They'll test you for Hep C antibody, which just shows if you've been exposed.
Why wouldn't they just test me for everything?
The antibody is good because it'll just show enough to see if you need to continue forward.
Okay, the antibody shows that I've been exposed.
Right, yeah.
It does not necessarily mean I'm infected.
Correct, yeah. So what they'll probably usually do when they order the blood test is if it tests positive, then it'll automatically do an RNA test or a viral load test to see if you actually have it in your system.
So if the virus is floating around in there, doing damage, having a little party in there, doing all the things. Okay.
Yeah, doing all the viral
all right,
things,
so the virus is having a party. Okay, now I found out I've been exposed.
Right.
Okay. Now, here's my next question. I've had a girlfriend or two. Do they need to get tested?
They should probably get tested just in case.
Okay.
But
that's not going to be a happy phone call, by the way.
Yeah, I'm sorry about that, Chris.
Yeah.
But at least she won't have to, deal with liver cancer later, right?
Right.
Yeah.
Right.
So it's a difficult phone call, but at least you could save someone's life. So,
okay.
Yeah.
Okay. All right. That's fair enough.
Yeah.
That's fair enough.
Yeah.
Okay. Because I can imagine, if somebody were to come back with that, like, how do they do that?
Right.
How do they have that conversation with somebody? Because you don't know where you might have picked it up along the way.
Yeah, and sometimes a lot of people don't even know when they might have been exposed. Because if you're thinking back in the 60s, maybe you were exposed to blood when you got some dental surgery and you don't even remember, You don't think of that as
I didn't even think about that, but you could have had a dentist that wasn't doing a good job of sterilizing his equipment.
Right, back in the day, right?
Wow.
Yeah, so it could be any of those risks.
I like that term, back in the day. That's such a Hawaii term, isn't it?
We could sing a song about it, but or I like to say old school, so.
Old school,
but I don't like to, but old school ways, back in the day, right? There was just a different time in terms of medical procedures and how blood was handled and things like that. So. I always remind people, it's sometimes it's not even what you did. You were just born during a time where you're more at risk, baby boomers, right? So.
Well, I think we have to take a commercial break. Is that right? Okay, we're going to take a commercial.
Sure.
I'm Chris Lethem, and this is The State of Health, and we'll be right back.
Hi, I'm Ethan Allen. I'm the host of Likeable Science on ThinkTech Hawaii. We talk about why people should like science, why science is actually fun, how science is a dynamic and vital part of everyone's life, why everyone, every man, woman, and child on the planet should really know science, should love science, should be familiar with science. So it's a great show. People come on here and have interesting conversations with us. They tell us why they do what they do, why they love it, why we should love it too. I hope you'll join us every Friday, 1 to 2 p.m. And of course, you can see it anytime on YouTube. Aloha.
Aloha, my name is Josh Green. I host a show called Healthcare in Hawaii here on ThinkTech. We get together once a week or sometimes twice a month. Depends when we're busy. We get together less often, but we love to see you here to talk about the preeminent healthcare issues in our state. Our programs vary very widely. We talk about economics, we talk about healthcare, we talk about social issues on this program. Thanks for joining us.
Hey, we're back again. Hi, I'm Chris Lethem. This is the Hawaii State of Health. Today's guest is Thaddeus Pham. Thaddeus is with the Department of Health, and you are the Queen of Parent for the...
Your Majesty will do, as I've said before. The Queen of Hepatitis.
The Queen of Hepatitis here. Yeah. Okay, so we're talking a little bit about sort of the concerns of, okay, I've gotten screened. I found out that I got the little virus doing a little dance in there.
Right. Yeah.
Okay. He's doing his thing, and we wanted to get him out of there.
Right.
So now that you've sort of gone, okay, well, all right, I got him doing a dance. Now I need to find out what kind of hepatitis, because there's more than one.
Right. Yeah. So
within the hepatitis.
Within
C.
hepatitis C. Yeah.
Okay. So you got groups.
Right. They call them genotypes, and there's usually different. I think the ones that we see most in Hawaii are 1, 2, 3, 4. So it's pretty easy, right?
And that leaves 5 and 6 hanging out.
Right. They can have their own parties somewhere else.
They're having their own parties somewhere else.
Yeah.
Okay. So we got 1, 2, 3, and 4.
Right.
Now, why is that important?
It affects how well the treatment will work for you. Because the treatments are made to target specific types of Hep C. So,
okay, so depending on who's having the party, you're going to apply the right medication to knock him out.
Right, exactly.
Okay, all right.
It's either like calling the cops or calling the neighbors,
Yes, that's right, because if your house is on fire, you want to call the fire department.
Right, exactly.
Yeah, that's right.
Yeah.
You want to call the right.
Yeah, we can go far with this analogy.
Okay, but there's other kinds of tests too. And, in the old days, one of the concerns is, my sister had to have this done, was called a liver biopsy.
Yeah.
Oh, that's a mean and nasty little test.
Yeah.
Very painful.
Yeah, you know, did she talk to you about it at all?
Yes,
What did she say
yes.
about that? I'm curious.
Oh, she cried.
Yeah.
She cried.
Yeah.
The doctor told her it wouldn't hurt, and he lied.
Yeah.
But the good news is, they don't have to do that anymore.
Right, yeah, so now, and we discussed it a little bit before, but now they have this elastic wave.
Yeah, the
type,
elastic wave.
Which you
yes.
really like to say. But so FibroScan is the name of the machine that can do this. So it's a non-invasive way of assessing how damaged your liver is,
So
basically.
this is a kind of ultrasound.
In a way, yeah. It can see pretty much how elastic or how hard your liver has become.
Because a good, healthy liver is flexible, right?
Right.
It's very flexible.
Yeah.
But a bad liver is getting hard.
Right, it's
because
all
it's got
scarred.
scar tissue,
Yeah.
right?
Yeah.
Okay. So,
so
what you want to do is try to preserve your liver. But
right.
And because I could see where somebody says, you know, I've got this disease, but you know, the treatment sounds worse than the cure.
Right.
Or the cure sounds worse than having the disease.
Right.
But today, that's just not true.
That's not the case anymore.
Right.
I mean, it's really, you know, back in the day, like you said, old school, that with your sister, she took interferon and probably ribavirin for a year. She went through a lot of hard times, and she made it, I'm assuming. Okay, that's great.
Yeah,
so
yeah.
nowadays, it's, you know, 3 months or even less for some folks. The cure rate is much higher.
And you just take a pill.
Yeah, and it's 1 pill a day for some people.
Yeah.
For some people, it might be 2 pills a day.
So
I mean,
you don't have to get a biopsy.
Right.
So you can figure out what the group type is, or the
genotype by blood.
Genotype,
right.
sorry.
Yeah.
The genotype by the blood.
Right.
You don't have to get a biopsy. It's painless treatment.
Right. Yeah.
Right. You don't have to get any shots, or most generally.
Most people don't.
Yeah. Most people don't.
Yeah.
You don't have to get any shots. And you're done in a very short period of time.
Yeah.
And it's a pill a day.
Exactly. And the cure rates are way higher.
Wow.
So you have way better chances nowadays. So
that is just amazing. You know, I love it when technology works.
Yeah, I know it actually happened in our lifetime. So I think it's a really amazing time for hepatitis C.
So
to get people.
hepatitis C is on his way out.
Yes, yeah.
Yeah.
So now we just have to make sure that people know they have it, so they can get the treatment. So it's really important that people, you know, like we talked about before, baby boomers, people who've injected drugs, anyone exposed to blood, you know, any of those people, just to get tested and make sure that they don't have it, or if they do, that they get cured.
So do you have a chat with doctors and say, you know what, maybe when your patients come in and they meet a certain profile,
right,
maybe you should suggest this test?
Yeah, we sent out a letter last year from the Department of Health to all doctors across the state recommending that they do this.
And did you start to see the testing occur? I mean, did the insurance companies report back that they were reimbursing for the test?
Yeah, we saw some initial data that there was like a spike in it, and then it dropped again. So I think it's just reminding people over and over, and also empowering patients to say, hey, you know, I want this test. If your doctor doesn't know about it or is unsure about it, you can ask for the test yourself.
Okay, so what do I call the test that I'm asking for? If I go into the doctor's office, do I say I just want an antibody test?
Yeah, you could say I want an antibody test. You could say I want to be screened for hepatitis C. And the great news is that we work a lot with a community organization called Hep Free Hawaii. And they have a website, and we're locally based. It's hepfreehawaii.org.
Hepfreehawaii.org. Hepfreehawaii.org.
Yeah, and it's great because all the materials, like referral letters to doctors, the names of the tests, all of that is on the website. You can download it and take a letter to your doctor that says everything for you.
It has everything, all the information on it.
It even has billing codes for insurance companies. So we try to make it as easy as possible.
So you have the diagnosis and the billing code, so the doctors know exactly what to put down on the paperwork, so the insurance companies will reimburse them.
Exactly.
You've done a great job here. It sounds like you've covered all your bases.
Yeah, we try. Yeah.
Yeah.
Still a lot of work to do, but yeah.
But yeah, it is. And so the question is now, what about people who don't speak English?
That's a really good question. So most of the people who don't speak English that we are working with go through community health centers. And the nice thing is that the community health centers have interpreters or community health workers on site. So we link with them too and really encourage them to stay in their medical home so they feel comfortable, but reminding them that they can get this test done there as well. So
now, is there a copay?
Okay, good question. There is supposed to be no copay because it's a preventive service. So under Affordable Care Act, service like a Hep C screening for people at risk has no copay or deductible for patients.
So the good news is I don't have to pay for it.
Yeah, which is always
I'm
good.
not going to have any pain.
Right.
and you know, I can get screened for it, and you can do it. You know, a lot of times when they draw blood today,
Right.
They draw blood for multiple things.
Right.
So it doesn't require necessarily an additional needle prick either.
Yeah, so they'll just draw an extra blood, add it to your panel, and then you'll know if you don't have it, you're good.
Okay.
If you do have it, you can get treatment and then be cured, and you don't have to worry about liver cancer later, right?
Because you get two primary issues: is liver cancer and sclerosis of the liver.
Yeah, cirrhosis. Yeah.
Cirrhosis.
Yeah.
I said it wrong. Cirrhosis.
Right.
Cirrhosis is what?
Cirrhosis is inflammation or scarring, right?
Right. But it also impacts the functionality of your liver, right?
Yeah,
I mean,
yeah.
eventually you're clogging it up.
Yeah, exactly. So
the scar tissue, you know, is supposed to be this porous thing.
Right. And then it becomes a lot more difficult for your liver to kind of do what it needs to do.
Right.
Yeah.
Now, if you stop the disease, does the liver have any sort of regenerative qualities?
Yeah. So it might take a while, but the liver can heal. The thing is, if it goes, you know, if it's gone too far, I mean, if you already have cancer, it might be already too late, right?
Yes, yes.
And that's kind of the sad things that we hear about in the community, is some people do get cured, but they're getting cured when it's already approaching cancer. So they end up with cancer anyway.
Oh.
Yeah, so that's why get tested early, that you can get rid of it early, and you don't have to deal with cancer at all.
Yeah, because, you know, nobody likes to play with cancer. That's just a I mean, it's such a, once you get to that stage, I mean, the fight is on. Yeah,
the fight is, and you know, we only have one transplant center in Hawaii, so that fight is a really difficult fight for a lot of people.
So we don't have a lot of transplants occurring in Hawaii, liver transplants. Is that, now, how important is it for people to do donor cards? Can people still do liver transplants for somebody that, say, was, I mean, is that still an ongoing thing?
I think so, yeah. I'm not as familiar with the donor system, but I do know that there are donors available. But again, you know, it's very limited in who can get the
Because
donor.
a liver, does it require any sort of matching like kidneys do?
Yeah, I believe so.
There's a matching component to it?
I mean, it's not my area of expertise, so I can't really say for sure, but I'm assuming that, there's some kind of matching component. And also they kind of assess, you know, if you need a liver, you know, you have to kind of meet certain variables as well, right?
Because you only get one liver. It's not like kidneys. You don't get two, right? Liver, there's just one.
Yeah.
So you got to take care of it.
You got to take care of it, and you have to have a lot of built-in support, right? So it's not just anyone can get the liver. You have to have a lot of things in place. So a lot difficult.
Okay, so transplants, don't count on transplant.
Yeah. So let's get to it before it gets to that stage.
That's right. Okay. Now, great drugs. We're going to talk a little bit about some of these new medications that are available.
Right.
Some of the terminology that's used here is a little bit complicated. I was looking at it, but I've lost my card on the, oh, here it is, my card on the different drugs. So here's a drug called Olysio.
Yeah.
Olysio, is this one of the newest drugs that have come out?
Yeah. Olysio is also Cimeprevir. So
it's the same thing as Cimeprevir.
Yeah, so Olysio is usually used in combination with another drug.
Which is ribavirin?
No, in this case, it's with Sovaldi.
Sovaldi,
yeah, so it's only for genotype 1, and it allows it to be so that you won't need to use interferon, so you don't have to get injections.
Okay, so that takes care of genotype 1.
Yeah, and there's a lot, the genotype 1 is really prevalent. There's a lot of people with genotype 1, so a lot of the drugs only tackle genotype 1.
Oh, okay.
Right now, yeah.
Because that is one of the most prevalent.
Exactly.
Okay.
Yeah.
Now there's subtypes too, right?
Yeah. 1A, 1B.
1A, 1B.
Yeah.
Okay. And of course, these all sort of get, or they're measuring these differently, the results to make sure that they're providing the best combination of drugs.
Yeah.
And the right combinations to have the highest
impact
or cure rate.
Definitely.
Okay.
Yeah.
And then there's a drug called Harvoni.
Yeah, Harvoni's the big player. Like, if we were talking old school before, this is like new school, new kid on the block kind of thing.
Okay, I love the new kid on the block. Everybody loves a new kid on the block.
Yeah, I do, and I love new kids on the block too, so that's great. So Harvoni is like the new kid on the block.
Well, there's just no accounting for musical taste, is there?
Please don't judge me, Chris.
Okay.
But yeah, so besides New Kids on the Block, we do have Harvoni, which is the big player.
Okay.
It is that what you mentioned before. It's the 1 pill a day drug. So it's a 1 pill a day for genotype 1, really effective, really easy to take and easy to manage, and it can be really short. It can be as short as 8 weeks, so 2 months for some people.
So in as little as 2 months, you can be cured from hepatitis C.
Yeah,
Wow.
yeah.
And it's a pill a day.
It's a pill a day.
Wow.
Yeah.
You can take that with your vitamin.
Yeah, yeah.
Or your orange juice every morning.
Your vitamin C, yeah.
Now, there's another drug called ribavirin.
Yeah, so ribavirin is part of the old school regimen, but they still use it.
Okay.
And what it does, it usually helps with the cure. I think from what I've heard, they're not sure exactly how it works, but what it does is it helps the cure kind of stick, or helps you reach that cure.
Okay.
For some reason. So not everyone needs to take it, but in some cases you still do.
All right, okay. And then, I guess, are there any other drugs, or is there anything else coming down the pipeline?
Well, you know, like Hep C right now is that exciting time for us. So there's another drug called Vicurapac that's out right now.
Okay, now what does that treat?
That treats genotype 1 as well for hepatitis C. And it's a few pills, so it's not one pill a day, but it's equally as effective. So there are more options for people that they can take.
Now, one of the things that we got to talk about here is cost. I think we need to take another commercial break. Is that right? Okay, we're going to take another commercial break, and then we're going to come back and talk about some of the challenges with the cost of these medications, because unfortunately there is no free lunch. We'll be right back, and this is the Hawaii State of Health, and stay tuned. Aloha.
Hi, Jay.
Hi, Keith.
My name's Keith Bettinger.
I knew that.
And I'm the host of ThinkTech Asia.
I knew that too.
Here on ThinkTech.
Fabulous. You got a great show going, Keith.
Thank you very much. And for our viewers out there that are interested in ThinkTech Asia, it airs every Tuesday from 4 to 4:45, and it can be accessed online at thinktech.com.
Yeah, so what kind of guests you like?
Well, we have a number of guests from academia, from practitioners of international affairs. Sometimes we have military officials. Sometimes we have public officials on the show. And our goal, we try to talk about current issues in South Asia, Southeast Asia, East Asia, and Central Asia, all throughout the Asian realm, in more depth than you would find in traditional mainstream
That's
media.
the difference, isn't it?
Exactly.
That you're reaching out beyond what ordinary news media would do.
Right.
That's why we like you so much.
We're trying to provide a thinking person's perspective, an intelligent perspective on what's going on, and we're both sides of the story, or even when there's more than two sides, we try to cover every angle. And I think that's one of the big benefits that we provide here at ThinkTech. Is it's a really innovative source of educational programming for the people of Hawaii.
You're great, Keith. You are a great host. You got a great show going on. I watch it every week.
Thanks very much.
Why don't you guys watch it every week too, okay?
4:45 to 4 to 4:45 every Tuesday.
Hi, I'm Chris Lethem. Welcome back. I'm still getting used to the camera location position, but this is the Hawaii State of Health. Today's guest is Thaddeus Pham. He's from the Department of Health, and we have been talking about hepatitis C.
Right.
Now we've talked a little bit about, how it gets treated. How do you kind of determine whether or not it might be something that you're at risk for?
Right.
And then we've talked about these really weird and wonderful medications that we have today to treat the disease. But as I said earlier, there's no free lunch.
Right, yeah.
These are expensive meds.
Yeah, yeah.
So now this is a problem because, of course, now under Obamacare, there's more access to medical health, or to health care. But this could break the piggy bank.
Right, yeah. So this is, for people who are working in hepatitis C, this has become a major barrier to care for a lot of people. So the cost of the drugs are pretty high. And when you take into account the amount of people now who are interested in getting the medication, right? Because it's way easier to take, it's shorter. So that means a lot more demand for an expensive drug. And for the insurance companies, it becomes really difficult to cover the cost for everyone because, it's going to, like you said, break the bank in a sense, right? So that becomes a barrier to care for a lot of people in that.
Well, I'm sure the insurance companies are looking at the cost of this.
Right, yeah, they are.
And now are the drug companies themselves providing any assistance?
Yeah, they're providing patient assistance, and they're also providing some copay assistance for folks. So I think it's one of those larger healthcare topics that really, I mean, it's almost outside of our realm. It requires economics. It requires a lot of other players to kind of figure out this issue.
Well,
Yeah.
are these drugs just expensive because they're arbitrarily expensive, or is it just because the complexity and the work and the effort it takes to produce these drugs is just so fantastically technologically challenging?
You know, that would, because that would be a question that we would have to probably ask the pharmaceutical companies.
Yeah.
Because we don't, I mean, it's all based on kind of what they tell us. So all we know is it's an expensive drug, and the expense of the drug limits how many people get access to it. Because insurance companies, since they can't afford to treat everyone, limit it to people who are typically a little bit more far along in the liver disease. So
what you're telling me, and that sounds a little scary, is, oh, you're not sick enough yet, we're not going to give you the funding that you need to get treated until the disease actually damages your body.
I would
That's a
say
scary
that's,
thought.
yeah. So
That's a scary thought.
It's a scary thought, and that's why it's a lot of people are really interested in the topic right now, because, you know, when do we, an interesting example is in Spain, they work the opposite way. So they only give the medication to people who are not the sickest. So the people who are the sickest don't get as easy access to the medication.
Wow,
so it's a flip side. So
that's a flip side. So
right.
Okay. So if you're somebody who's young, you may want to go to Spain.
So have fun.
Yes,
you know,
go
learn
to
Spanish,
Spain, yes.
right? But unfortunately, also in other, so what the companies do is they also limit who can receive the medications in other countries as well.
I would
Right,
suspect that's going to be an issue. But
Right,
you know what?
yeah.
Send it the formula to India. I don't know why, but they seem to figure out how to make these drugs far cheaper.
You know, I think they did, but I think India has a very strict, they have a very strict agreement where they cannot provide these their generic version to anyone else who's not an Indian citizen or something like that.
Okay.
Yeah, so there's a lot of limitations.
Okay, so I'm going to be working on my Indian accent so I can go to India to get the treatment that I need.
Chris, continue to work on that accent.
You know, this is an interesting dilemma, isn't it?
It's definitely a dilemma, and I think it just makes us think about healthcare in general. And, you know, hepatitis C, I think, is really important as also a flashpoint for larger health issues like healthcare access, you know, the increasing role of insurance companies in deciding, you know, who gets access, things like that. So I think,
this is an ongoing issue because as we, especially Hawaii, as our population ages.
Right.
And of course, in Hawaii, we live longer than any other state.
Right, yeah,
in the
we're the
nation.
healthiest
And
state in the nation.
Well,
right. According to that survey.
Okay, we're the healthiest state in the nation. Okay, I like that. Okay, but we have life longevity. But with longevity also comes, you know, our bodies need more maintenance. They need more health care.
Right, yeah.
Okay, and one of the challenges, of course, is that who's going to pay for that? Because if we have a, you know, it used to be that our population growth was like this, the older people at the top, and now we're sort of turning into this.
Right.
We're having less children. The people that came up as the baby boomers, there was an explosion in population, but then the generation after them sort of had the 2 and a 3rd child.
Right.
But the next generation, they're my children, for example, not having kids, aren't looking to have kids.
Yeah.
They're really career focused.
Yeah.
So that means there's a much smaller pool of people who are generating the revenue and the income.
Right.
To finance the people, the older people at the top.
Right, yeah. So these are all larger issues that I think touch on our work with hepatitis C. So, you know, it all comes back to just making sure that at least people are aware of the issue and that they hopefully can get access. So right now we're just trying to increase that access by leveraging those health systems and figuring out how we can all play together in a sense, right? So
well, these are some of these are some of the unique challenges that we have here in Hawaii in lots of things like Alzheimer's and dementia with a lot of the older people. As they get older, they hit their late 80s, their 90s, the incidence of Alzheimer's and dementia increase substantially.
Right, yeah.
The cost of care is expensive.
Right.
We need to address that. We need to be able to help people age and stay in their own homes. How do we do that? And I honestly think a lot of these solutions lie within technology.
Right.
I know legislation is great in terms of pointing resources, directing resources, but ultimately technology provides the solution set that we need to address a lot of these issues effectively.
Right.
And addressing costs and such.
Right, I would totally agree with you. Like, for example, there's a really great program out of New Mexico called the ECHO Project. And they started in Hep C, and what they did is they used technology. So they did not a telemedicine, but a telementoring thing, where they would have a specialist talk once a week to rural providers. So country docs who want to treat Hep C and don't know how. And they use that weekly kind of co-case management.
It's also a great reminder.
Right, yeah.
Yeah.
Yeah, and it kind of helped those docs feel comfortable enough to treat and to take care of their community. So, you know, hopefully we'll get something like that one day in Hawaii where we can help our neighbor island folks who have a lot less resources. So,
and maybe we could bring back the super ferry so people could easily get back and forth, wouldn't have to fly
I'll let you work on
expensive airplanes.
I'll let you work on that. But
well,
for now,
these are all, the great thing is with telemedicine, and I'm involved with a company that does ultrasounds, and we use this ultrasound imaging, and telemedicine is a big part of the industry today. It helps to reduce costs, helps us to find people who are really good at what they do, and allows them to specialize and provide better care for less cost.
Yeah, and it helps you to build capacity in areas that might not have access, right?
That's right. That's right.
And so, I mean, like when we talk about saving costs too, it reminds me of like hepatitis C. In a way, if we prevent or cure hepatitis C early, then you're saving costs for liver cancer, liver transplant, all those ancillary kind of costs that come after the fact,
and those are expensive.
Right? Those are really expensive.
Well, they're complaining about the $85,000 or $90,000 they're spending on this treatment.
Right.
But if somebody has cancer, wouldn't the treatment go way beyond that?
Right. Yeah, it would be way more expensive. And there are a lot of studies that show the cost effectiveness of treating early. But again, it's many issues, and that's why it's hard to kind of. I would never want to point a finger or anything because it's a huge monster to tackle.
So it's kind of like what I could sort of envisage from the insurance companies. They're saying, well, we're willing to treat, based on our population, we're willing to treat X number of people each year. We can sustain a certain volume of treatment. And I don't know if you want to call that rationing, but certainly you don't want your insurance company to go bankrupt because they spent so much money that force them out of business, or otherwise they jack up the premiums beyond the point where we can't pay for it.
Right, and it's really just thinking of how to make things sustainable, right? So how to balance there's so many stakeholders now in the healthcare kind of world, right?
Yes, there is.
Especially with the Affordable Care Act coming into play, especially with wonderful, amazing drugs like these new Hep C ones. So figuring out how everyone fits into the healthcare world. And that's what I think that's what we've learned is public health is not just, public health.
It's also economics.
It's everything.
That's right. It's economics. It's understanding the culture, habits, behaviors, and then how do we become effective in treatment and also prevention.
Yeah. And that's a lot of the work that we've been doing in hepatitis C. I mentioned Hep Free Hawaii as our coalition. A lot of the work we do is coalition building and engaging those partners to move forward together. So rather than demonize one group or point a finger at one group, it really helps to figure out how we all want to move in the same direction.
So if people wanted to reach out to you and talk to you more about this issue, how would they get a hold of you?
They can go to Hep Free Hawaii's website and just say, hey, I want to talk to Thaddeus to contact us. You can email me.
They can call?
Yeah, they can call me. So do you want me to give you my phone number? Or?
Phone number or direct us to where you can find, like, the Department of Health? Or?
Probably you can always call, and I'll look into the camera for you. So you can always call me at 808-733-9298. So 733-9298, that's my direct line. You can just always call and ask for Thaddeus. So.
And just ask for Thaddeus.
Ask for me, the queen, right?
The queen of Hep
C. But I really feel, especially in Hawaii, that relationship and that partnership building is important. So I value any input. I really love when people reach out to me so I know what's happening and how we can kind of address things. So, yeah.
All right, well, very good. I really want to say how much I appreciate you coming on the show today.
Oh, yeah, thank you.
And I'm very happy to fill in for Jay Fidel. I know Jay's very disappointed he couldn't be here.
I'm sure he's really bummed right now.
Well, it's been a great show, and I just want to encourage people to, if you have concerns about Hep C, ask your doctor. Remember, today you can get treatment and care without spending any money, without experiencing, well, maybe not say experiencing, you don't have to pay copay to find out if you have the disease. And certainly the treatment today is painless.
Yeah, much
for the most
easier,
part. So for Hep C. So don't be afraid to ask your doctor, and I encourage everybody to get tested. Thank you for watching the State of Health, and I'm Chris Lethem, and I'm sure Jay will be back next week to talk with more folks like yourself.
Great.
And have a great Tuesday, because we all know Tuesday is the greatest day of the week.
It's the best day.
The best day of the week. Aloha.
Thank you.
Thank you for watching.